Melissa, I just had the worst dream. I was in a horrific car accident and I broke my arm and Addie's legs were paralyzed and I'm so freaked out and I wouldn't know what to do if it happened in real life and what our recovery would look like. I need you to come over right now. I need the advice of an OT. Addie's coming over too. See you soon.
Alyssa, we know you're an OT, but what exactly do you do?
Well, I'm an occupational therapist and I work in rehabilitation and disability settings. I address the needs of people with injuries, illnesses, or deficits in occupational performance due to other causes. My goal is to help people return to the activities that they need and that they want to do. I help ensure patients can function in all of their environments with the abilities that they have.
So, where exactly do you work?
For rehab and disability, an occupational therapist can work in a variety of arenas and specialize in different areas. An OT can practice in acute care rehab in a hospital setting where they are instrumental in an individual's functional recovery. An OT may specialize in hands as a certified hand therapist, driver rehab, or specialize in neurological rehab. OTs may also be critical in working with individuals with chronic disabilities. OTs may specialize or see patients in outpatient clinics, in assisted living facilities such as nursing homes, or even visit the patient's home.
Alyssa, what types of groups and populations do you work with rehab and disability?
Well, OTs see individuals with a variety of diagnoses in this setting. The main ones can include individuals with a brain injury, a spinal cord injury, someone who's had a stroke, been diagnosed with cancer, chronic diseases such as cerebral palsy. They can do hands and upper extremity rehabilitation, work with the community with mobility and driving, and a lot of other developmental and intellectual disabilities. All of these injuries and disabilities impact a person's ability to perform basic tasks that are critical to their everyday lives. For instance, in your dream, Angie, you were left with a broken arm. In rehab, an OT would work to increase function in that arm and learn new ways to complete tasks or activities with one hand while your other were recovered. These tasks could include taking a shower, cooking, and other things. Addie, with a spinal cord injury resulting in a lifetime of disability, an OT would be critical to help you function in your everyday life. We would work on relearning to complete tasks such as teaching you compensatory methods, providing adaptations to your everyday life so you could do the things you love while in a wheelchair.
So, Alyssa, this might be a silly question, but why are you called an occupational therapist? Do you help people get jobs or something?
No, but I get asked that question frequently.
Oh, okay.
No, I'm actually called an occupational therapist because occupation actually refers to the meaningful activities that people do every day and how they occupy their time. While sometimes this can include a person's work or job activities, it has a broader interpretation that includes everyday activities of daily living, such as getting dressed, instrumental activities of daily living, such as grocery shopping, rest and sleep, education, social participation, leisure, and play. As a rehab OT, we often use occupations that are important to the person during treatment sessions. This makes therapy relevant and meaningful to the patient in order to increase function in their everyday lives. By using occupation, we are able to address all the areas of life, such as cultural, temporal, personal, and virtual contexts.
Okay. So, Alyssa, what do you mean by cultural, temporal, virtual, and personal?
Well, as an OT working with individuals from a variety of cultures, we try to incorporate their beliefs into therapy. This may include addressing a family as a whole during therapy as opposed to just treating the individual, if that's what their culture calls for. Personal aspects may include those things that are unique to the individual, such as driving rehab for an older individual. Temporal aspects include working with people throughout time, such as people who are born with a disability, like cerebral palsy. Virtual aspects include working with people and technology, such as teaching people to communicate with computers or other devices.
Oh, okay.
So, Alyssa, where did you go to school?
Well, I went to the University of Mary's Distance Education School in Billings, Montana, to earn my master's degree in occupational therapy. The University of Mary and the Centennial Vision of the American Occupational Therapy Association, known as AOTA, are aligned in their desire to promote occupational therapy as a science-driven and evidence-based profession that meets community needs. In just 2 short years, in 2017, both the profession of OT and AOTA will turn 100 years, which is really exciting. So in accordance with this centennial vision, OT practitioners in rehab and disability utilize evidence-based interventions, they collaborate with other professions, and they conduct science-driven research in order to provide the best quality of care to patients of all ages and abilities, as well as to gain recognition for the profession of OT.
Thanks, Alyssa. That was really interesting to learn about occupational therapy, but all of this talk about it makes me hungry for some ice cream. And Angie, this time I'll drive.
Sounds good. Let's go, guys.